Red light, green light, efficient communication of COVID screening status for nursing home transfers. As healthcare providers, it is our responsibility to provide best care and ensure safety for patients. Poor communication, inefficient information sharing, and information omissions are challenges associated with patient transfer, and COVID-19 has further complicated care transition, especially with older adults. This is why our aim is to develop a system where every nursing home resident will receive a wristband with a QR code to improve communication and transfer for both patients and providers.
On the bottom right of this slide, you'll see a figure we created that outlines how our system will work. As an overview, residents will be given a wristband with a personalized QR code that links to a PDF document. This document will contain pertinent information about that patient in order to avoid communication errors when transferring our residents. The first step is to scan the patient's QR code. The first page of the PDF that pops up will include the patient's COVID status. The second page will be a HIPAA consent form for the residents that have agreed to participate. And the last page will be some of the patient's relevant past medical history, including medication changes made at the hospital.
A brief plan for our proposed project is, first of all, to explain the importance of limiting needless medical errors and improving seamless triage for patients to our nursing home staff and hospital staff members to get their buy-in. Secondly, considerable somewhat amount of training will be needed to train the support members to obtain consent, consistently use this, also using coordination with IT members to develop the QR code template and be able to enact safety restrictions so that there's no HIPAA violations, and then ultimately optimize and troubleshoot with other local hospitals and care facilities.
So for putting this plan into action, on the day of a patient's discharge from the hospital to a nursing home, social work will educate the patients about the purpose of the wristband and the information to be shared. And at this time, they'll obtain patient consent as well. When patient discharge paperwork is printed, an IT reminder will pop up in the system to remind us to give patients their wristbands on the day of discharge. And at that time, the PDF will be created with their COVID status and consent as well. And it'll be connected to a QR code and uploaded. And then when patients leave the hospital, they will be provided their wristbands.
And one of the ways we want to assess quality improvement is by using a standardized tool called patient reported outcome measures. So for example, specific to nursing homes, we really want to know how residents rate their frailty, mobility, and activities of daily living. And we also really want to know if they have experienced changes in respiratory status, mood, sleep, especially during the pandemic. And ideally, this data would be collected before and after the transition of care.
Our primary outcome, focusing on general patient care needs beyond COVID, assesses the rate of acute adverse medical events in the QR bracelet intervention group compared to those receiving the current standard of care. Secondary outcomes include provider satisfaction with the system, focusing on whether our intervention effectively and succinctly communicates acute care needs to the receiving facility or endpoint caregiver. Finally, as with any new intervention, costs must be considered to assure limited resources are utilized effectively.
The largest strength of our QR code method is in the efficiency and accuracy of communication. We unfortunately live in an era where different hospitals all use different medical charting systems that do not communicate with each other, and this may cause getting correct information very cumbersome and delayed. This method will allow medical personnel to quickly able to learn the incoming patient's COVID status, allowing the fast triage into appropriate COVID units. It's also very simple and easy to use by any healthcare personnel with a smartphone and tablets devices. There are some foreseeable challenges. It does expect the facility to be equipped with the correct technology, and there are variations to access to these technologies across different nursing homes. This also requires steps to be more attentive to protect the patient's privacy, as their medical record will be being carried around with them in the form of a QR code. They'll be asked to consent, but the patient may refuse to consent. The health information contained will be succinct and it will only contain information that's crucial to the safe transfer of the patient and will not be updated, so it should not be solely relied upon as one's medical record.
To overcome the challenges, we can offer education sessions to medical personnel. To protect patient information, we will consent patient before linking them to the QR code. If the patient refuses to be consented, we could offer a blank wristband indicating the transfer only. We can set the linked PDF file to expire after a short amount of time. In addition, we may educate the nursing staff to use the information for transfer purposes only. For the next step, we will encourage as many nursing homes and hospitals to be enrolled and expand the safety use of this technology. Thank you, and we're happy to answer any questions.